Hello everyone. In today's video, we will be discussing the maternal medicine module. It can be a very simple module if you just get to know the basic idea behind this, or it can be very complicated if you start looking at the scenarios, because there could be hundreds of scenarios that you can think about which can be very complicated as well. So let's try to make it simple and easy for understanding so that you can do any kind of maternal medicine scenario without any kind of difficulty, even if you haven't seen that scenario. So let's see how we can simplify it for exam purposes. So this module is basically about preconception counseling and health education. It can be a huge module, as I said, and because you can never cover all the cases from every system, and in fact it's very important to keep it simple. So just try to prepare for the common cases, and in case you identify the module and know the template for this module, it will not be a problem for you. So just follow the template and you will pass the station, even if you are seeing that scenario for the first time. And most of the time the patient will either present in pregnancy, which is early pregnancy, or before pregnancy. So if they present with for a pre-pregnancy counseling, discuss with them the plans of the pregnancy, and discuss with her about the disease, the medication, the tests, and her last visit with her physician. And also ask about the contraception and make sure that she's using a reliable method until she conceives, especially if she's taking some teratogenic medicines. Review her medicines to make sure that the medicines that she's using, they are safe in pregnancy, and tell her that she will be switched to safe alternatives in pregnancy. In addition to the routine care in this pregnancy, tell her that she will be offered some additional care, and it's the purpose is to make sure that she and her baby are healthy. While discussing about her pregnancy, take her throughout the pregnancy, that she will be booked in a consultant unit, and an MDT care will be provided to her, a team of professionals. They will be looking after her. MDT does not necessarily mean a group of doctors, because some people understand from MDT that it will be an obstetric consultant and a physician and a group of doctors, but it's basically the GP and the midwife and some specialist nurses, for example, the diabetic nurse, and sometimes social workers are also involved in women with complex medical background as well as complex social background. So you have to mention the names of all these people if she asks about the details. Otherwise, just keep in mind that it has to be an MDT, and MDT is a buzzword, and try to use this. So take her throughout the pregnancy trimester wise, and also discuss about the birth planning at 36 weeks of pregnancy, and you can also involve the anesthetist at the time of birth planning, and discuss with her that you will see your anesthetist at 36 weeks to discuss the most suitable forms of anesthesia for you. After delivery, you will see your physician again, and so that you can be given the medicines which are safe while breastfeeding. And don't forget aspirin, don't forget folic acid and thromboprophylaxis. And in most of the medical disorders, you will have to discuss all these things, especially thromboprophylaxis. Okay. And you can make up using this information, you can make some templates related to any symptom, any system, for example, renal, respiratory, cardiac, neurological, and there is a lot of information on the NHS website, NHS choices. There are different websites related to different systems such as Marfan, and asthma, diabetes. So you can look into these specifically when you are preparing for a scenario, but it will definitely not be difficult if you take it this way, that is, involve the MDT in her care, involve the obstetric and the medical obstetric consultant and the medical physician in her care, and take her throughout the pregnancy and making sure that she's using safe medicines in pregnancy. Okay, so let's focus on some common scenarios that you can encounter in this module. Diabetes. especially type 1 and type 2 diabetes, and women can present with an uncontrolled diabetes, a very high HbA1c level for pre-pregnancy counseling. Then you have to tell them about the control of diabetes, and because an uncontrolled diabetes can have impact on her baby, they are at a very high risk of having abnormalities, fetal abnormalities, and also pregnancy complications. And once she starts pregnancy with a good control of diabetes, the risk of complications reduces. And similarly, for high blood pressure, you have to make sure that she's taking safe medicines. For example, if a woman is taking ACE inhibitors and she is in her early pregnancy, just discovered that she's got pregnant, so she has to stop these medicines and switch to a suitable alternative, for which you will make an urgent referral to her physician. Okay, so again, involving the MDT, if she presents with for a pre-pregnancy counseling in the with the history of a chronic or essential hypertension, then you will make sure that she's taking the medicines which are not teratogenic, and then again you can refer her to her physician so that they switch her to suitable alternatives and give her a green signal that she is well enough to go ahead with pregnancy. And then when you discuss about pregnancy, you can discuss about aspirin, and you can discuss about the risks in pregnancy, development of preeclampsia, small for gestational age baby, and how you will be monitoring this pregnancy. If she needs any additional growth scans, at what timings you will be offering them. So things like that. Okay, and similarly for thyroid disorders, this is also a very common medical disorder. You should know about the follow-up and the safe medicines and impact on baby and impact on her general health. So it's important to be familiar with some common scenarios. And for the rare disorders, if you do at least one or two, that should be enough. But some of the rare conditions such as Marfan syndrome and Alport syndrome and a few others, they also have got a risk of genetic transmission. So don't forget to discuss that when you are discussing the pregnancy, that there is a possibility of transmission to baby based on what kind of disorder is that. Okay, so this is how you can take this scenario, these kind of scenarios. And similarly, if we talk about the genetic transmission for sickle cell anemia and thalassemia as well, there is a risk of genetic transmission. So in these situations, you have to make sure that the partner is not positive. And if they come in early pregnancy and the partner is not tested, then testing of the partner, and if the partner tests positive, then further testing of the baby. So you have to discuss all these things. Okay, and then involving some relevant specialities. For example, if we talk about diabetes and high blood pressure, then it could be a physician. But when we talk about von Willebrand's disease or any other bleeding disorders such as hemophilia or any other blood related disorders such as a history of DVT, okay, so we have to involve the hematologist in those situations as well. Talking about their renal problems, renal physicians or nephrologist. Okay, and similarly for infectious diseases as well, risk of transmission to the baby and to the partner, and what kind of vaccination you can offer her. So these are the things that you will be discussing in this module. So if you make a template, just focus on a general history, pre-pregnancy and early pregnancy, and then take her trimester wise, and then discuss about MDT care, discuss about 36 weeks birth plan, and safe medication, switching back to her pre-pregnancy medication if they are safe in pregnancy, or otherwise any suitable alternatives when she is breastfeeding as well, and her follow-up after delivery. I hope you can do these kind of scenarios very easily now. And for any other things that you think that we can discuss and I can help you with, just send me a message. I will make more videos for you. Thank you.